Well, I'm pleased to say we're joined here on the conference floor by Niall Dickson, Chief Executive of the NHS Confederation, which represents organisations in the health service, and Andrew Selous, MP, who is a Conservative member of the Health Select Committee. Welcome to both of you. Niall Dickson, first of all, what was your response to the announcements that were made by the Health Secretary?
Well, I think the announcements that were made were really positive, and I think our members, for example, will be quite impressed by the fact that the government has listened around selling NHS land to provide affordable homes. The increase in nurse training places is absolutely welcome. Indeed, the learning culture, his emphasis on moving from a blame to a more learning culture, all those are real positives. But
right.
It would be remiss of me, I think, not to reflect also what our members are constantly saying, which is that the health service is in an extremely fragile state, that it is heading towards a really difficult winter at the moment, that social care remains, in spite of the government putting in extra money, social care remains a real problem. That wasn't mentioned either. And lastly, the funding of the health service going forward, and obviously we're anticipating what might happen in the budget, and the Secretary of State's unlikely to anticipate that, but the reality is that the current figures are frightening for what they've penciled in for the health service over the next couple of years. We need an extra boost.
Right. Are you equally frightened about the prospects for the NHS that Niall Dickson has said it's unsustainable going forward as it is?
Well, I think what happened today was tremendously good news with the extra nurses which are being announced, 5,000
Sure.
nurses a year.
And no one would disagree with
fantastic. But there's a really important point as well, in addition to what Niall has said, about quality, which Jeremy mentioned, because he made the point that poor care is actually the most expensive type of care you can have when things go wrong. So focusing on quality, getting infection rates down to the level of the best, actually helps trusts live within their means.
Sure, but if they're not fit for purpose, then none of those other things are going to matter, are they?
But if we focus on quality, we've got more staff, we've got more nurses coming in, with more doctors.
You haven't got the staff yet,
year,
have you? You're getting them in.
But the commitment is there to get them in, and also the flexibility, bringing back nurses that have, that need more, that have maybe retired recently, want a more flexible lifestyle, dealing with some of the housing issues, is really important. But the Getting It Right First Time initiative and improving quality is absolutely vital to helping the NHS live within its means as well.
Do you think the leadership in the NHS, in NHS Trust, has fallen short?
What I'm seeing at the moment is clinicians recognising that they need to move up to the level of the best. It is not acceptable. There are 20 times higher levels of infections in some hospitals rather than others. And that costs a lot of money. It's not just a terrible thing for the patient who gets infected, it's actually costing money.
Right, so it's about the leadership. It's about the quality of leadership at the top of the NHS, which is why the quality outcomes have fallen.
Well, I think the challenge that Andrew was making was actually to clinicians there about addressing variations in that. But I think, again, we're in danger of getting exactly into the blame game. Of course, there are unacceptable variations, and I think the service is absolutely up for tackling those variations, both the management and the clinicians. But I think the levels of pressure, and this is what really must be recognised, the levels of pressure that people are working under at the moment. There are hospitals with 26% vacancies. There are hospitals with 4 wards filled with medically fit people who can't get out because of social care. That's the reality of the day-to-day that people are facing at the moment. And I think, as well as the good things that are going on, you need to recognise that pressure.
Right, well, none of those things are going to respond to what's been set out here by Niall Dickson. 26% of vacancies in some hospitals mean they can barely function.
But that's exactly what Jeremy addressed today, isn't it? The increase in training, helping nurses who've left, who've retired, come back, providing them with more flexible ways to work. All of those will help and are really necessary. But your leadership point, if I may, is a really important one as well. And actually, Jeremy made that point this morning. He said hospitals going into special measures, it's the same staff that gets them out. It's getting the inspirational leadership to focus on what is wrong, driving up the quality, and then we will see improvements.
Brexit is a big issue for the NHS because recent statistics broadly have shown that many EU nationals who are nurses who've been working here, many of them are going back to their countries of origin. You've actually gone as far to say that patients are actually at risk with Brexit negotiations. Why don't you fight harder to stay in the EU?
Well, I don't think it's for us to fight harder to stay in the EU. I think it's our job to make sure that the Brexit negotiations don't harm the healthcare system, and indeed where there are opportunities that we take those opportunities.
But are they not already harming, in your view, the NHS if
well,
you're
I
losing
think
staff?
Well, we haven't had Brexit yet, but I think the effect of the referendum and the uncertainty which a lot of EU staff feel has had a bad effect. There are other effects, like the effect on the pound, so they're earning less than they would and sending less money home. There are other factors as well, but I do think there is real concern among staff, and I think they will welcome the Secretary of State's, again, assurance that they are welcome here, because the message that we're getting is quite a lot of staff are saying we don't feel welcome anymore.
Right, just briefly before I let you go, Andrew, on the comments of your colleague Philip Lee, who said that the NHS is basically a Ponzi scheme that's about to collapse. Why should the under 45s fund, the pensions and healthcare of those older than them, and it won't be there when they finally retire? Do you agree with him?
What we have at the moment is an NHS that's been rated by the Independent Commonwealth Fund as the best healthcare system in the world. We all know the things we need to do to keep improving it. It's changed throughout its history. We're focused on leadership, focused on quality, getting the workforce issues right. It'll be sustainable for the future. Right,
so he was scaremongering.
I think if we focus on the key issues and absolutely social care, where there's a big piece of work to be done, the NHS is sustainable for the future.
Gentlemen, thank you very much. Now, Ellie's back with her moodometer. How have you got on?
I was just having a look actually, Joe. It is